Assalamu alaikum.
Walaikum salam.
My name is Rashid.
Welcome, Rashid. I believe that you've read a brief description of the case outside. You can proceed with your case.
Okay. So it was a 90-year-old female who was brought by her daughter. She was feeling dizziness and nausea.
Right.
Did we triage the patient?
Yes, she is trying.
Can I get the vitals, please?
Sure. Her heart rate is around 75. Blood pressure is 90 over 55. Respiratory rate is 12. Saturating 95% on room air. Temperature is 37.6.
And did we get blood glucose?
Yeah, that's 6.4.
Okay. Can I talk to the patient?
Sure, go ahead.
Hello, ma'am. My name is Dr. Rashid. I'm going to help you today.
Doc, I feel very tired. I'm dizzy.
I'm sorry to hear that. Since when did this start?
I'm dizzy. I'm tired. Speak to my daughter.
Okay. Can I talk to the daughter?
Sure.
Hello, my name is Dr. Rashid. How can I help you today? I'm taking care of Mama.
Right. So today I walked in at home and I saw my mom on the floor and she was more confused. She was very confused. So I decided to bring her. She's been feeling nauseated, vomiting, and this has been going for a few days now.
Okay.
She hasn't been taking well orally.
Okay.
That's it.
Is this the first time that she's developing this confusion?
Yeah.
Okay. Did she complain of anything else before, like headache?
Nothing that I know of. No.
Okay. Does she have any past medical history?
She is on multiple medications. I can't recall all of them right now. I remember I do have it on my phone. I'll show you later on.
Okay. Can I move to examination of the patient?
You can go ahead.
Can I assess her airway? She's talking, so I'm assuming that it's patent. There are no signs of obstruction.
Right, correct.
Okay. Her breathing, I have her saturation is 95%.
Right.
And her RR is 12. Auscultation of the patient, what does it show?
So you'll start listening to her chest, shows bilateral equal air entry, no added sounds.
Okay. No asymmetrical movements or anything.
No, none.
Okay, I move on to circulation. I already have a blood pressure of 90 over 55. Can I palpate like radial pulses bilaterally?
Right, so it's radial pulse strong, present.
Okay, and her capillary fill.
Around 3 seconds.
Okay. I'd like to get an ECG, please.
Sure.
If we can insert 2 large bore IV cannulas. I'd like to draw some blood as well. If you can get a VBG, some electrolytes, a full blood count, maybe some inflammatory markers as well. And if you can give, please, 500 normal saline over 30 minutes for this patient, and we'll reassess her BP after.
All right, so blood's taken, sent for lab, ECG is coming up, and she started on normal saline.
Okay. I'll move on to D. So
Right.
how are her pupils?
Equal reactive bilateral.
Okay, and her GCS?
It's around 13.
13 out of 15. Okay.
Right.
Uh,
And as you go on further, you're gonna take do more physical exam. Nurse comes to you, tells you, doc, the patient's heart rate dropped to 40 and her blood pressure, we cannot read it.
her heart rate up to 40 and you cannot read the blood pressure.
No.
Can I feel a pulse on the patient?
Yes, there is a pulse.
Okay. And is she breathing spontaneously?
Yes, but she's more confused.
Okay. If she's not already in a resus room, I'll move her to a resus room. Connect her to pads. What's her heart rate right now?
40.
40. Can we give her, so she's 40, so she's in symptomatic bradycardia right now. So
Right.
I'd like to give her 1 milligram of atropine.
Sure. Atropine given? Nothing.
I'd like to repeat the atropine if possible.
Alrighty. So a second dose of atropine was given. Nothing has changed.
Okay. So at this point, we'll consider maybe transcutaneous spacing.
Okay. She's already on pads. You started her on transcutaneous spacing, which is not improving her
She's not
situation.
responding.
No.
Okay. Do you have any?
So the
ECG
daughter comes, tells you, yeah, sure. And the daughter is going to show you the medication after this.
Okay. So ECG
What do you see?
is showing a heart rate of 40, and I see some PVCs as well.
Right.
No, there's ST segment sagging.
All right. Okay.
She can sometimes in digoxin use. Sometimes you see.
All right.
Okay, and that's it.
So ST sagging could be with a lot of things, including what you mentioned.
Yeah,
All
can
right.
be
And
ischemia, can be
the daughter comes, shows you the medication that she's been taking, and tells you that this is the medication, and you see that she's on warfarin, she's on metoprolol, she's on ramipril, she's on rosuvastatin, levothyroxine, and digoxin.
okay. So some of her some of her BP medication could have caused this, maybe the beta blockers,
Okay.
and maybe it was also the digoxin could have caused this.
Okay.
So we can try giving her the digifab
Right.
since she's symptomatic now with the while being on this. So like assuming it's maybe an overdose.
Okay.
So we give it and see the response to the treatment.
Anything else?
Can I see her blood gas?
Sure. So her blood gas shows you a pH of 7.3, PCO2 of 24, bicarb of 15, lactate of 2.6,
And what's her potassium?
6.8.
Okay, so we also need to correct her potassium.
Okay, so what do you want to do?
We can give her a dose of insulin dextrose.
Okay.
And maybe some salbutamol nebulized.
Okay.
Can I get another set of vitals after the treatment?
Sure. So you've started her on the on the Digimind. You've started her on salbutamol. You've started her on insulin. She's been improving now. Her heart rate went up to 120. Her blood pressure is 100/60.
Okay.
And her rhythm is AFib.
But she's stable. She's more
She's more
talking,
awake. Yeah,
alert,
she's more
awake
awake.
now. Did I get anything of the other results, the blood results?
Like what? What do you want to know?
Inflammatory markers
It's within normal limits.
within normal limits.
Yeah.
Okay. The electrolytes, sodium.
132.
Okay. So right now she's more stable now.
Right. So what do
So
you
we
want to
can
do?
now, we need to admit this patient. She needs admission to monitor bed or ICU at the moment. And we'll hand over the case.
Okay. Anything else before you end your case?
She's her blood pressure is okay. Her heart is a little fast. She's AFib. If she's stable right now, I don't think I would add anything.
All right. Thank you very much.
Thank you.
This was a case of a 90 years old patient with digoxin overdose. During the course of the examination, the participant addresses the stability of the patient and the proper allocation of the patient. Focused history should be taken, including past medical and surgical history, medication, and allergies. Reassessment of a patient's vital is paramount if patient's status has changed. Recognize the potential overdose or toxicity for digoxin in elderly patients. Recognize the features of digoxin use, overdose, or toxicity on ECG. Demonstrate an approach for the treatment of digoxin overdose. Proper disposition of patient after management and stabilization of the patient is done.